the Forgotten Trimester YouTube channel, where we discuss all things postpartum. I'm your host, Dr. Megan Gray. I am a board-certified OBGYN, mom of two littles, educator, author, and physician leader. On this episode, we are talking about the golden hour. What the heck is the golden hour, right? You will learn what the golden hour is, why it's so important, and how you can advocate for yourself for it. Let's get started. So the golden hour is the first hour after birth, that first hour that the baby has been delivered and is transitioning. It is an important time frame for both you and your baby. For baby, it is an important transition from inside the womb to outside in the world. For you, it is an important time to observe for uterine tone, so how contracted down the uterus remains, and for vaginal bleeding. Both of you guys, both you and the baby, are transitioning from being pregnant to now being postpartum, and for baby from being inside the womb to being outside in the world. One of the key factors of the golden hour is using it to do skin to skin. What is skin to skin? So this is when we take the newborn baby and place the baby directly against your skin. So that means no wraps, no blankets, no towels, no shirts, nothing in between your baby's skin and your skin. So a lot of times people will take the gowns that women wear during labor and place the baby underneath the gown directly up against the skin, and then put blankets over the baby to keep the baby warm. And we want the baby to rest on your skin, chest to chest, tummy to tummy, for that first hour. There are many benefits to skin to skin in that golden hour right after birth. It's been researched. There is plenty of documented benefits. So let's go through those really quick so you have an idea of how important this 1 hour of skin to skin right after birth is. For baby, it assists the baby in regulating its temperature so that the baby's not too cold or not too warm. It helps the baby regulate his or her own blood sugars. It also helps regulate the baby's heart rate. I have been delivering babies for 18 years, and as the baby comes out screaming, as soon as you put that baby on mommy's chest, the baby just calms down and just is quiet and so comfortable. And it's just because he or she can hear your heartbeat. And it's just an amazing, amazing thing. As far as maternal benefits for skin to skin, there's known improved bonding. When you put mommy on or baby on the chest, there is a surge of oxytocin. Oxytocin is a hormone that does a couple things. One, it's a feel-good hormone, so we know that it improves mood. Number two, it tells the breast to let down milk or to release milk out of the breast tissue. And three, it tells the uterus to contract. So those are three very important things in that first hour after birth. Because then not only do you have an improving and bonding due to the oxytocin, you also have an improved expulsion of the placenta because of the oxytocin, and a reduction in the risk for heavy bleeding after delivery because of the oxytocin, because that oxytocin is also making the uterus contract down and stay contracted. So that's a great thing. It is known to increase rates of breastfeeding for women that do skin to skin for that first hour after birth. And it does have a calming effect also for mom. So not only is the calming effect for the baby, but it is also for mom. So I always suggest that first hour after birth, skin to skin as much as possible, if possible, and shut out all the other noise. I know it's so tempting in that first hour to want to take pictures and text everybody and phone calls, but you only get this one time to do this one thing for an hour. And I would just suggest that you just keep it calm, quiet, and stay in the moment. You'll have plenty of time to alert the world that the baby's here. but take that first hour after birth and just be there with that baby and your partner and just smell the smells, feel the feels, just be in the moment and experience it. So let's talk about why you wouldn't be able to do skin to skin in that first golden hour. So number one, if the baby comes out, whether it's via vaginal delivery or C-section, it requires more aggressive management to transition from the womb to the outside world. Then the baby will more than likely need to go to a warmer bassinet to be further evaluated. Or number two, if mom is unstable, if the mom after delivery is bleeding heavily, has a huge tear, and is very uncomfortable and is unable to hold the baby, those would be two main reasons why you wouldn't be able to perform skin to skin in that first hour after birth. Now let's talk about how to make skin to skin a thing for you. So if you are planning a vaginal delivery, talk to your physician or your midwife well in advance, so a couple weeks before you plan on delivering or before you become full term, and ask them, does the hospital that I'm delivering at allow for skin to skin in the first hour? Most hospitals that are designated baby friendly are performing skin to skin in that first hour and make it a priority. So find out if your hospital is baby friendly. You can call the labor and delivery unit. If your doctor or midwife don't know, call the labor and delivery unit at your hospital and ask them. They will know that. They'll know the answer to that. Another question is, what about cesarean sections? Can I do skin to skin with cesarean sections? And the answer is a little longer than just yes. Technically, yes, you can. You have to have a hospital that is willing to do that, which means they have to have enough staff. Someone has to stay with the baby once the baby's delivered and assessed and brought over to mommy. So with a cesarean section, usually what happens is the baby comes out and the baby's taken over to a warmer to be assessed by a team of nurses or physicians for further evaluation. Once they've deemed that the baby is healthy and safe, they will bring the baby over to you. A lot of times it's just to take pictures and then they take the baby out with daddy. If there's enough nursing staff or someone to stay with the baby, they will allow the baby to stay with you and can place baby skin to skin on your chest while the physician is finishing up your cesarean section. So that's another question to ask your physician or your midwife. If I require a cesarean section during my labor process, is it a possibility that I will be able to do skin to skin in the operating room? And if they don't know that, you can call the labor and delivery unit at your local hospital and ask them how they do that in the case of a cesarean section. Now, ways to kind of circumvent that. If you end up with a cesarean section, and let's say you aren't able to do skin to skin in that first hour while they're finishing up, a lot of times they'll take the baby out with daddy or partner. The partner can do skin to skin while you are still in the operating room. So have your partner educated on what skin to skin looks like and what it feels like, and allow them to do skin to skin. They can put baby up against their skin, waiting for you in the recovery room, if that allows. Option two is as soon as you're done with your C-section and you go to the recovery room, ask the nurses to place baby skin to skin as long as baby is healthy and doing well in the recovery room. So pull down your gown, put the baby there, skin to skin, no blankets, no gowns, nothing encumbering skin against skin. So that's another way to do skin to skin. Now, it might not be that whole first hour, but it's something. And it is that transition. And even if it's an hour after that first hour, that is better than nothing, and it still will help. So those are the basics of the golden hour. I encourage you to do skin to skin in that golden hour. It's so very important. I've seen it so often in my work. I didn't get to do it with my first because I did have a cesarean section, and at the time they weren't doing that yet. That was about 6 years ago, and they weren't doing that in C-sections. But with my second, I did get to do that, which was an amazing experience. So I encourage you to do skin to skin and stay in the moment. So that wraps it up for the golden hour and skin to skin. I hope this is super helpful and it spawns on some conversation with you and your physician or your midwife. Certainly, if you have any questions, drop them below. I'd love to answer questions. If you like the topics you're seeing, please subscribe. You'll get an alert. We will be doing one topic a week. And I love getting information. So if you have a topic you would like to be discussed on YouTube, please drop that below. I'll put a little video out for you. If you're not already following me on Instagram, check me out on Instagram. Tons of helpful tips, and hints and topics, and just some support. And so we'll see you next week. Have a great day. Bye.